Hello and welcome to Bottom Line. I'm Cindy Kainz. We have a great show for you today. We're going to learn about physical therapy, also known as PT, from my guest for today's show. She's the founder of Dawn Thomas Physical Therapy, Dr. Dawn Thomas. Welcome to Bottom Line.
Good morning, and thank you so much for having me. I'm looking forward to talking with you today.
The same here. I know myself, I've done some physical therapy, and possibly those who are watching might have as well. But if for those that might not be as familiar with physical therapy, can you talk a little bit about how physical therapy has come about and evolved?
Absolutely. So the start of what we know today as physical therapy really began during and after World War I, when there was a need out of necessity. So the United States government gathered up as many women as they could that had some kind of background in like physical education or teaching or some kind of caregiving, and they taught those people, trained them how to help the soldiers when they were injured and how to assist wounded soldiers in their healing journey. So that's really, and we were called restorative aids at that time. And that's kind of important for as it evolves over the years, because that's one of the reasons why it's predominantly still today a women-dominated profession. And the start of it as being the connotation of being an aid, I think, is kind of important, because as the decades went on, we started to gain more autonomy and gain more sound backing by science and tried to gain more respect in the medical community. But the root of our starting point was as aids. And I think that connotation kind of stuck with us for a long time. And then as the decades went on, we started making the education more robust and more based on science, and the search for autonomy and the desire to be respected as medical providers has been a long road, and it's taken a long time for us to gain that respect and to be accepted in the medical community as doctors of physical therapy as we are today. So that's one of the interesting things I think is really interesting about the history of how we started.
And it's fascinating that you do mention that and how it began and how it seems to have even more women who have been more physical therapists over time, and even how that's evolved. How have you seen the field of education for physical therapy evolve as well over these years? Is it constantly where we're learning things new about the body that we can understand how we can restore it, because you mentioned kind of being restorative aids before in this field?
Yeah, I think it's just been a really gradual process. And so, that was 20s, right? Then we had other people in the profession, some key people that were also women, that kind of had this drive to do things differently. So the next wave of doing things differently and needing more people to do physical therapy was after the polio epidemic. And there was a woman, Sister Kenny was her name. She was actually Australian. And she, at that time, across the world, when the polio epidemic was going on, and in the United States, the main treatment for polio was immobilization and bed rest and immobilizing the limbs that were affected. And Sister Kenny, she did things differently in Australia, and she used warm compresses and range of motion and movement as therapy for these kids that were afflicted with polio. And she observed that the kids that were getting the warm treatment and the movement and were moving their limbs that were affected had a better outcome. And so she had the wherewithal to kind of push that concept. And that's really significant, because now, present day, we have tons and tons of research that has taught us why that is and why movement is medicine. And that's really a big part of my messaging to people. Movement is medicine. And it took someone like that with the guts to do things a little bit differently. And then she was recruited by the Mayo Clinic to come over to the States to teach people and how to use this movement as medicine instead of immobilization. And that's stuck with us to this day. And it's a big part of why we know what we know, and why we were driven to do research based on that, and how we have terms like neuroplasticity, and we know things about what happens to the brain and the muscles when we stimulate it with movement and stimulate it with exercise.
That's fascinating. I've never known that, about with the polio outbreak. And now, we think now today it makes sense. As you were saying, the movement, we've learned that so much. In fact, I'm always amazed when I hear, friends and colleagues or someone, they have some surgery and that day they're up and, moving or walking, and it versus bed rest, like you said.
Yes.
So,
yes.
It is fascinating how that's come about. So thank you for sharing that history, because it's something definitely I was not aware of, and it's great to know and understand.
Yeah.
And how is it, here is where I've thought of things as I've thought about physical therapy over the years, even in my younger days and as I get older. A lot of times I think people have this concept, how is physical therapy going to help me? How is it really going to make a difference, and why should I do it? How do you see some of your patients and clients coming through, and maybe how they changed their mindset once that you started working with them?
Well, I think the biggest key there is education. So really starting from a point of, where is this person's starting point? Learning where their starting point is, what their goals are, what their background is, what their exercise background is, what their body awareness is, what's going on with them medically, and kind of teaching them about their body and why it's doing what it's doing, to start to get them to appreciate what is happening, what they have control over, what they don't have control over, and what modifications to make to have the best outcome, to meet the goals that are important to them. And I think that sometimes people have the impression that it's not going to help me because of a past experience, because they tried it and it didn't work. And that sort of sometimes is because the needs weren't met. So for whatever reason, whether they were put in an environment that didn't give the time or the attention that they needed to get to the root of the problem, or they just weren't ready, or nobody found the actual root of the problem. So I think a lot of times people come to me with a prior experience that maybe was unsuccessful. And then when they experience a session or an assessment session that's a true team effort in understanding to find the problem, to problem solve the solution, then they start to understand a little bit more about their body and how to make some changes to get to the goal.
Right. And I think, you really kind of nailed it there when you said, and it's like with anything, a bad experience or something, even if you go to a restaurant or whatever, you experience something bad and you associate it and you say, okay, well, I'm not going to do that again, or I'm not going to go there again. So I think that's really important. And if someone's watching and they want to, they want to have a good experience, of course, they know you have your place that you've started here, Don Thomas Physical Therapy. But are there questions that maybe, or things online type of investigation that they should look at, or questions they should ask to make sure that they have the right physical therapist for them?
Yes. So the first thing I would say is be an advocate for yourself, and don't be afraid to ask those questions, and don't be afraid to ask if you go into a facility and you're going for a specific problem. Say I have hip pain or I have knee arthritis and I'm going to a clinic. It's okay to ask if the person, what are the credentials of the person that you're working with? What is their background? What kinds of experience have they had with your particular situation? Is the other person that's working with you a physical therapist? A lot of times in the way that our medical system has evolved, unfortunately, we have been forced to do more with less. And sometimes you don't know what credentials the person has that's working with you. And that matters in how skilled they are in giving you the care that you need. So don't be afraid to ask. if that person is a physical therapist or not. And it's okay to go somewhere else if you're not getting the attention that you need. And I think, unfortunately, this kind of goes back to the history, like when we were considered restorative aids, and then decades and decades and decades later, when we've enhanced our education to doctoral level education, and we know so much more that our profession is science-backed. And then the squeeze of the medical system has kind of forced us to do more with less. And it's not the therapist's fault that's in the room with the person, but they're being squished, and it's hard to give the quality of care that they want to give when the person's standing in front of them with all the constraints that they have. So for the person, the consumer, don't be afraid to ask questions, be your own advocate, and don't take the bare minimum for that's all there is.
Right. That's great points. Thank you for sharing that, because, it's like the same thing with, if you have your doctor that you're with, your primary care, you want to have that relationship. And the same thing goes for a physical therapist. You want to make sure there's that connection, that, they understand you and your personal needs, so that you can, be able to heal from whatever reason you're there for. And speaking of that, one of the things I found fascinating over the years, and maybe people who have had physical therapy or might experience it, is that sometimes you'll help me with exercises and it's my own body weight. And I'm not, and it's amazing that you'll have me turn my arm or leg or this a certain way, and all of a sudden it's a taxing exercise that is good for you, of course, to help you. How is that sometimes, is that a myth that sometimes we forget that our own body weight is all that we need, that we don't have to be lifting heavy weights and things like that to be able to do an effective exercise?
Yeah, so you're talking about, there's a lot of different factors that go into what you're talking about. So, a lot of things can give us resistance. So we want muscles get stronger with resistance, bones get stronger with resistance. So things that can provide resistance are gravity, your body weight, resistance bands, weights, compression. All of those things can create resistance for the body. So depending on so a therapist will know how to position your body in different ways to maximize or minimize gravity and your body weight. So an example might be a push-up. So if I'm going to do a full push-up in a full plank position, that's going to be a higher level of difficulty. But the same muscle groups and the same abdominal contraction, the same chest contraction, and all the muscles in the upper body that are being used, the same pushing pattern could be used doing an incline push-up at a kitchen sink, in which it would be largely easier and less resistance, but still resistance nonetheless. So it's a matter of understanding the physics of the exercise and the geometry of the muscles in order to know how to make it harder or easier. We call that scaling an exercise.
And that's great to know too, because, what's also important is, like you said, some individuals, based on their body and their health and their ability, their strength, to do a full push-up like that, and others who could still benefit and could do the one that's off the kitchen sink and still get the benefits for that. Do you find that the other thing is, I know, when somebody like myself, from going to physical therapy, like you said, I'm my own advocate. I want to get in there. I want to get my exercise. I want to do well. I want to get better. And I know that many times I get exercises to take home. Do you encourage I'm saying this because I try to take it seriously, and I take them home and I try to do them so that I can do things at home on my own and then go into the, physical therapy, if I'm doing it in person, to take advantage of the equipment that's there. What would you coach your clients on to make sure that maybe they do pursue, things at home during their own physical therapy sessions?
Yeah, absolutely. That's a huge part of physical therapy, is educating the person on how to progress themselves, how to maintain what you've gained within a skilled session. Usually the starting point is, I ask them kind of how they learn best. So what's the best way for me how are you more likely going to do this? Is it video? Is it written handouts? Is it stick figures? Is it you writing it down in your own handwriting? Is it photographs? What of these techniques is going to make this a habit for yourself? And also understanding how much is realistic for that person. So like, are you going to do this for 5 minutes a day? Are you committed to 20 minutes a day? What's realistic for you? Because it doesn't matter what I give you, it matters what you're going to do. And so kind of teaching people how to integrate new habits into their life, that's a big challenge for all of us, right? So teaching them about how to integrate the habit. And if that means it's one movement, that means it's one movement. I'd rather them do one movement every day than do 10 movements every 10 days. Like, it's super important. The consistency is so much more important than volume. So I really try to kind of get an understanding of where their starting point needs to be. And if I get a sense that, this list is too overwhelming for them, then we change it. Okay, then we just what are the most important things to do? And we focus on that.
And I think that's key. And I commend you for, it just shows, again, your personal commitment to wanting to make sure you're helping the person in the way that's best for them. Because we all know we learn in different ways as we grow up, as, from kids to adults and things like that, how we learn at school and so forth. So that really is an important thing. And I think, again, as you mentioned, it's what are they going to get done maybe per day versus over like a 10-day period. Do you find that when a session is ended and is there a certain amount of time that someone should continue to do their physical therapy for that particular maybe injury, or is there something that they just need to continue to do and integrate into their daily lives?
So the best answer to that initially is move, rest, move again, forever.
Okay.
And over years, people always come to me with like, what's the best genre of exercise class? Should I do Pilates? Should I do yoga? Should I do boxing? Should I do da 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 da? And then we talk about what their kind of issues are and stuff. And the bottom line is always this. I say the best genre of exercise for you to do is the one that you'll do. So it doesn't always, some of it matters, like there's specific issues, but the consistency is the key. But your original question was about like recovering from an injury or something that you would typically think of. So that's interesting to think about this, because sometimes there'll be specific exercises that are for, say, a shoulder recovery. And knowing when that those exercises are no longer applicable, kind of, you need a little feedback, right? So if you could get a little bit of feedback on someone reassessing your symmetry and your strength for the injured shoulder versus the non-injured shoulder, then when that strength equalizes, or that range of motion equalizes and becomes more balanced, then you need to transition into a maintenance or a wellness type of programming that maybe doesn't have to be so specific to that one side. So that's where I help people a lot with that, in transitioning to a wellness program or an exercise prescription. I call it medically minded exercise prescription, so that they're progressing from post-injury recovery to, okay, so now what do I do? Now I want to live my life. I want to play pickleball. I want to walk the dog. I want to be strong and live well longer. So what do I do now? And so then we design a program that they can follow through with, and we can coach them on we can drop those ones that were for the rotator cuff or the hip issue, and you can do something that's more global for your body.
And I think that's really helpful, to know. And it sounds like, if there's someone out there watching, maybe they could come see you and say, hey, I've now had the physical, like you said, for rotator cuff. I think I'm good, because I know there's many people out there who want to continue to do the exercises that are good, but, they're not going to want to waste time on exercises that aren't beneficial anymore at this point. And like you said,
Exactly.
People are busy and they might have limited time, so they want to use that best time that they have. When you say, and I think what's really key, as you said, movement, movement and rest, and do something that would help move and do that. If someone's watching and maybe they can't do Pilates, or maybe they can't get to the gym, but maybe they could at least walk. Is walking still a very valid and very good exercise for someone just to at least move? And again, you mentioned gravity, so hopefully that's kind of helping too with a little resistance.
Absolutely, absolutely. So I like to talk about just movement as medicine. So everybody's coming from a different standpoint of sedentary versus all the way up to very active. And so, these comments, are going to be different for each person. But absolutely, like, I think people think that exercise has to be a class or a gym or, something, this formal thing. And really, it doesn't. When we do heart rate based training, or we measure heart rate when we do activities around the house, cleaning, gardening, walking the dog, all of these, dancing, we're going out dancing with friends, and it can become a cardiovascular exercise. So these types of things, if you can include activity-based things that are both social and which gives you a health benefit from socializing, you get the benefit of the movement, you get the benefit of the cardiovascular conditioning, which also helps your mind. These types of things, you're gardening, you're touching the earth, you're getting the benefit of the nature. All of these different things go into it. So it doesn't have to be a Pilates class or a boxing class. It has to be something that you really enjoy doing, which is going to help habituate it for you, and that you get some of those benefits. And then from there, there's tons of ways to make it harder, to make it more strength focused or power focused, or depending on your goals. So walking absolutely is a great choice for someone to, and that counts as exercise. You don't have to think you didn't do the exercise that day.
Well, and I'm really glad that you kind of gave so many different examples of movements, whether you're gardening or walking the dog or anything. And it gets back into you're moving, you're up and you're moving, or you're doing things. Even gardening, you're moving around and things like that, even if you might be bending over on your knees and doing things in the ground with the dirt. I'm curious if when I think of sometimes resistance in that, can you kind of specify maybe when someone might use like resistance bands versus weights for certain things? Is there times when you'd use one over the other?
Yeah, for sure. I think I love the resistance bands. I use them all the time. I have my own loop bands, and I use them all the time because it's a really nice way to introduce resistance to all the muscles in endless variety. There's an infinite variety of ways to use resistance bands, and it's low load. So it's not going to be, it's very low likely to hurt you. So it's appropriate for almost everyone. So those are the reasons I use them all the time. And you can make it very challenging. You can make it very easy. And so free weights I would consider a little bit more challenging. There's a little bit less control. If someone has never done resistance training before, I'm going to start them with the resistance bands and then progress to maybe using some free weights after that. But on the same note, if we truly want to strengthen muscles, we need to overload them. So I think historically, we underprescribe exercise, especially for older adults, when we really could be tolerating a lot more resistance than we are willing to give them because of just perception and fear of injuring someone, or the perception of older people can't lift weights, or whatever these paradigms that we've been in. Those are not true. We can progressively load an older body, and it responds and it grows muscle. It does. So it works.
And so I'm glad you brought that up, because I wanted to ask you a little bit about the maybe the over 50, the over 60 crowd. Let's say the over 60 crowd. And if someone hasn't really done much earlier in their lives, can they if they're over 60, can they actually weight lift a little bit, and I don't mean a ton, and not like a bodybuilder, of course, but start weight and actually build muscle over 60?
They absolutely can. You absolutely can build muscle over 60. You just need to learn the correct positioning. You need to learn how to progressively overload the muscle. And overloading muscle will force the muscle to adapt and create more muscle. You absolutely can strengthen over 60, even if you've never done it before.
And see, I think that's key, even if you haven't done it before, because like you said, with the right person and the right physical therapist to help guide you to make sure you do it properly.
Mm-hmm.
One thing I want to talk about too, though, is our balance as we get older. Is there certain things we can do as we age to make sure for balance? Because, we all know later in life that somebody says they fall and they break a hip, and, and because of your bones and so on, there's so many factors in that. But can you talk a little bit about balance?
Yeah, absolutely. Balance is one of my key topics because I've got lots of blogs about balance, and I published a book about balance, a workbook that you can use to work on your balance. And we've done community classes about balance. So this is a close one for me. So there's tons and tons of exercises that we teach and that we work on that are very simple. And sometimes I don't even use the word exercise because people who maybe haven't done any exercise before get a little bit nervous about, I'm coming to an exercise class. So we talk about body awareness exercises in which we're working on our body awareness with our eyes closed, our eyes open, our feet in different positions, things like this to stimulate our vestibular system and all of the systems that are involved in maintaining balance. So I have this whole 6-week program that we work through that is, based on science that is going to helps people kind of build on where their starting point is, and becoming more aware of where your deficits are, I think is really the starting point, because we have ways, there's tests that you can do to yourself that give you information about where you're at with your balance and if you are in fact at a fall risk.
And that's what I was going to say. It's interesting because we might look at ourselves and say, I'm fine. I don't what balance. I can walk straight. I can walk backwards, left, right. What might be most shocking to people about when you talk to them and teach them through the 6-week course about balance? What might be something they're surprised by?
Well, I think most people aren't aware that they're already developing a balance deficit. So when I take them through some of the testing, for example, we do testing where you put your feet together and you close your eyes, and then you put your feet heel to toe and you see how your balance is. Then you close your eyes. Then you try to stand on one foot. And people are very surprised that when they close their eyes in any of those positions, they completely fall apart. And then they're like, oh my gosh, why can't I hold my balance with my eyes closed? And it's just a sign that we're relying on our vision, our visual information for our brains to perceive where we are in space. So our other systems, our muscles, our joints, our vestibular system, our strength, our flexibility, those things, something's lacking in those things if we close our eyes and we completely fall apart with balance. So then we need to investigate more and see where is this, and train it and challenge it so that it becomes easy again.
Yeah. Well, Dr. Thomas, thank you so much for all your expertise and all the things that you're doing, and for your clients. I'm sure they're very happy and pleased to have somebody with your background and expertise to be able to help them. As we kind of close the show, is there kind of one last word of wisdom you'd want to give to our audience who's watching?
My biggest message is always, don't be afraid to start a new journey of movement as medicine. Don't be afraid to start, no matter how old you are or what your background is. Everybody is going to benefit, no matter how intimidating it might be for you to start something new. Do it today. Start a new movement routine today and make it a habit.
Well, thank you so much, Dr. Thomas, for joining us. And I thank our audience for watching. I wish everyone the best of health. And hopefully, if you have an experience with physical therapy, and we've gotten a lot of great information today on just plain movement to help our health. So thanks again for watching. I'm Cindy Kainz.